There's something I need to tell you. It's something I've seen again and again in my years as a heart surgeon. And honestly, it still shocks me every time. It's not about surgery. It's not even about some rare disease. It's about a small, everyday pill that many seniors take without thinking twice. A pill that seems harmless on the outside, but inside your body, it may be quietly weakening your heart day by day. You might have taken it this morning, or maybe yesterday after your back acted up again. Maybe a friend or even your doctor once said, "It's fine, just take one when you need it." And for a while it works. The pain softens. You go about your day. But what you're not told, what most people don't realize, is what this little pill is doing behind the scenes, especially to hearts over the age of 65. That's why I'm here today. Not to scare you, but to protect you. Because the truth is, it's not too late to change course. Your heart is still listening. And every choice you make, even small ones, can help it stay stronger, longer. So if you're over 65 or care for someone who is, please stay with me. This could be one of the most important health talks you'll hear this year. And if you want more straight, honest, and senior-friendly heart health tips like this, hit that follow button. It costs nothing, but it could help protect everything, starting with your heart. Let's talk about that pill. The pill that seems harmless, but isn't. You've seen it on the shelf. Maybe it's in your bathroom cabinet right now. A small white bottle, maybe orange, with a label that promises relief. Relief from back pain, stiff knees, sore shoulders. For many seniors, it's almost automatic. Wake up stiff, take a pill. Feel that old injury flare up, take another. And why not? It's over the counter. No prescription needed. You've been taking it for years without a second thought. But here's what most people never hear. That very same pill, often labeled as ibuprofen, Advil, Motrin, or naproxen, belongs to a class of drugs called NSAIDs. And while they may help your joints for the day, they may also be quietly hurting the one muscle you absolutely cannot afford to weaken: your heart. It doesn't happen all at once. It's subtle. That's what makes it so dangerous. Over time, these pills can raise your blood pressure. They can cause your body to hold on to salt and fluid, which means your heart has to work harder to push blood through vessels that are tighter and more strained. It's like adding extra weight to your heart without you ever noticing. And if your heart is already aging, already facing years of wear and tear, that extra strain could be the tipping point. Some people find this hard to believe. It's just ibuprofen, they say. But as a heart surgeon, I've seen the consequences up close. I've had patients come in with worsening heart failure, shortness of breath, swelling in their legs. They never thought to mention their pain medicine, and no one ever asked. It seemed too small to matter. But it matters, especially after 65, when the heart isn't as forgiving as it once was. What we take, what we swallow, even something as ordinary as a pain pill, it matters more than ever. And this leads to the next question that too few people ask. What exactly happens inside your heart when you take this kind of medicine too often or for too long? Let's take a closer look. What these pills are really doing to your heart. Imagine your heart as a pump that never rests. Day and night, year after year, it keeps your blood moving, your organs alive, your body functioning. Now picture this pump trying to do its job while the pipes are tightening and the pressure's rising. That's what happens when certain medications, like ibuprofen or naproxen, start interfering with the way your body regulates fluid and blood pressure. These medications block an enzyme that normally helps your blood vessels relax and your kidneys flush out excess salt and water. When that enzyme is blocked, two things happen. Your blood vessels start to constrict, and your body begins to hold on to sodium and fluid. It's a quiet change, but it makes your heart's job a lot harder. It has to pump against more resistance, through narrower passages, with a larger volume of fluid swirling through the system. At first, you may feel nothing, maybe a little more tired in the afternoons. Maybe you start to notice some swelling in your ankles, but you chalk it up to the weather or sitting too long. But slowly, silently, that extra pressure is straining your heart muscle. And if you've already had high blood pressure, or heart disease, or even just the natural aging of your arteries, this added stress can push your heart into trouble. One of my patients, a 72-year-old man named Robert, used to take ibuprofen every day for his arthritis. He felt fine, until one evening he noticed he couldn't catch his breath walking up the stairs. By the time he got to the hospital, he was in early-stage heart failure. His blood pressure was high, his legs were swollen, and his heart was working overtime just to keep him standing. When we looked through his medications, it became clear. The daily ibuprofen, over months and months, had quietly tipped the balance. Stories like Robert's are not rare. They happen more often than people think, especially among older adults who are trying to manage pain without realizing the cost. And the truth is, not everyone reacts the same way. But if you're over 65, your heart is already doing more with less. Its walls may be stiffer. Its rhythm may be slower. It doesn't bounce back like it used to. And adding extra pressure, no matter how gradually, is a risk we cannot afford to ignore. So who should be especially cautious? That's where we're headed next. Who's most at risk? Not every senior who takes an over-the-counter pain reliever will end up in the hospital. But if you're over 65, there are certain conditions that make your heart more vulnerable, and they're more common than you might think. Let's start with high blood pressure. Nearly 2 out of 3 seniors in the US live with it. You might not feel it, you might think it's under control, but when you add a medication that quietly raises it even higher, your heart starts working under strain, and it doesn't complain right away. It just keeps pushing harder and harder until one day it gives out. Next is anyone with a history of heart disease. If you've had a heart attack, a stent, or even just been told your heart isn't as strong as it once was, then you're in the danger zone. These pills may seem like a quick fix for joint pain, but for a heart that's already compromised, they're like adding weight to a cracked foundation. Then there are those with kidney problems. Even mild kidney issues can change how your body handles sodium, blood pressure, and fluid. When kidneys are stressed, your heart feels it too. Taking NSAIDs can reduce blood flow to the kidneys, which makes them less effective. And when kidneys slow down, the heart often has to pick up the slack. And finally, there's a group that no one talks about: seniors who look and feel healthy. That's right. Just because you feel strong, walk every day, or manage your weight doesn't mean your heart is invincible. Aging alone makes your body more sensitive. Your blood vessels aren't as flexible. Your systems don't bounce back as easily. And so, even without any diagnosis, your heart may still be quietly absorbing the pressure from those little pills. This isn't about blaming yourself. It's not about guilt. It's about awareness. Because once you understand who's most at risk, you can start asking the right questions. You can talk to your doctor, look at your medicine cabinet, and make smarter choices before any warning signs appear. And that brings us to the next piece of the puzzle. If this pill is so risky, why aren't more people being warned about it? Why is it still so commonly used, especially by older adults who are the most vulnerable? That answer might surprise you. Why isn't anyone warning you about this? You might be wondering, if this pill is so risky for the heart, then why is it still sold everywhere? Why do doctors still recommend it? Why hasn't someone said something sooner? The truth is, the problem isn't always the pill itself. It's how we've been taught to think about it. These medications, NSAIDs like ibuprofen or naproxen, have been around for decades. They're familiar, cheap, and easy to get. No prescription needed. No special warnings unless you dig deep into the label. And because they don't act like a strong narcotic or make you feel different right away, they're often treated like a harmless tool in the medicine cabinet. For many years, doctors focused on short-term relief. Someone comes in with joint pain, and the first priority is to help them move again, sleep again, feel normal again. And in younger patients, that often works just fine. But in older adults, the risks add up quietly, and unless a doctor is specifically trained to look for those long-term effects, especially in the heart, they might not think to say anything. Not out of carelessness, but out of habit. Even the labels can be misleading. Sure, they mention heart risk, but usually in small print, buried among a dozen other side effects. And when you're just trying to get through the day without aching, it's easy to miss or dismiss a vague warning. You think, it's been helping me, so it can't be that bad. Or, if it was dangerous, my doctor would have told me. And sometimes your doctor simply doesn't know that you're taking it. Many people don't mention over-the-counter meds during appointments. They talk about prescriptions but forget the daily Advil or Motrin, thinking it doesn't count. And that small silence can have serious consequences. But here's the good news. Once you understand the risks, you have the power to ask better questions. You can bring it up at your next checkup. You can say, I've been taking ibuprofen for my knees. Is that still safe for my heart? That one question might lead to a safer plan, a different medication, or a lifestyle change that helps both your joints and your heart. The silence around this issue is one of the reasons I'm speaking up today, because you deserve the full picture. And more importantly, you deserve to know what signs to watch for so you can catch problems early before they grow. Let's talk about those warning signs next, because your body always gives you clues if you know how to listen. The subtle warning signs your heart may be struggling. Your body has a quiet way of speaking. It rarely shouts at first. Instead, it whispers. A little swelling here, a bit of fatigue there. And often we brush those signals aside. We tell ourselves it's just part of getting older. But when your heart starts to feel the weight of too much pressure, especially from medications that seem harmless, those whispers can turn into serious warnings. One of the first signs many seniors notice is swelling in the legs, ankles, or feet. You might look down and see your socks leaving deeper marks, shoes feeling tighter. It may not hurt, but it's your body's way of saying there's too much fluid building up. That's often a result of the heart struggling to keep up with circulation, especially if your kidneys are also under stress from certain pain relievers. Another common signal is shortness of breath, not the kind you get from climbing a steep hill, but the kind that shows up when you're doing something simple, like walking to the kitchen or talking on the phone. Or worse, when you're lying flat at night and suddenly feel the need to sit up or reach for more pillows. That breathlessness is a red flag that your heart might not be pumping as efficiently as it should. Fatigue is another clue. Not just a bad night's sleep, but a deep, nagging tiredness that doesn't go away. The kind where simple tasks, cooking, dressing, walking, start to feel like chores. You might feel weaker, slower, or just not like yourself. Some people notice changes in their heartbeat. It may feel faster than usual or irregular, like a flutter, a pause, or a sudden thump. While not all irregular rhythms are dangerous, any new change in your heartbeat deserves attention, especially if you've been using NSAIDs regularly. And then there's something even more subtle, the feeling that something just isn't right, a general sense of heaviness, discomfort, or unease that's hard to explain. Seniors often have great instincts about their bodies. If you find yourself thinking, this doesn't feel normal, trust that thought. It could be your most important warning. What's important to remember is this. These signs don't always show up in dramatic fashion. They creep in, slowly and quietly. And by the time they become obvious, the heart may already be under strain. But if you catch them early, there's time to act. You can make changes. You can talk to your doctor, adjust your medications, and begin to support your heart instead of unknowingly burdening it. So what can you do instead of reaching for that pill? Are there safer options, ways to ease your pain without weakening your heart? Absolutely. Let's look at those next. Safer ways to relieve pain without hurting your heart. Here's the truth many seniors haven't been told. Pain relief doesn't have to come at the cost of your heart. You don't have to choose between aching joints and a struggling heartbeat. There are safer paths forward, and many of them start with simple, thoughtful changes. One of the most common alternatives to NSAIDs is acetaminophen, often sold under the name Tylenol. It doesn't work the same way as ibuprofen or naproxen, which means it doesn't carry the same risk to your heart or kidneys. For mild to moderate pain, especially headaches or general body aches, acetaminophen can be a safer choice. But like any medication, it's not perfect. It can affect the liver if used too often or in high doses, so it's important to follow the directions and talk to your doctor if you use it regularly. Another overlooked option is physical therapy. Many seniors assume that pain is just something to live with, but gentle movement, guided by a professional, can reduce pain, improve flexibility, and help strengthen the muscles around sore joints, especially in the knees, hips, and lower back. You'd be amazed how much relief can come from learning how to move better, not just more. There's also growing support for natural methods. Applying heat or cold, using anti-inflammatory foods like turmeric, or omega-3s, or even gentle massage can ease discomfort without affecting your blood pressure or fluid balance. Simple things like warm baths, light stretching, and staying active each day can make a bigger difference than you might think. For some people, switching to topical pain relief, like creams or patches, can help. These products deliver medication directly to the sore area without pushing it through your entire bloodstream. That means less impact on your heart and other organs. But perhaps the most powerful tool is the conversation you have with your doctor. Not all doctors bring up these alternatives unless you ask. So the next time you're in the office, try saying something like, "I've been using ibuprofen often. Are there any safer options for someone my age?" That one question can open the door to better, more heart-friendly choices. You are not stuck. You are not powerless. Pain may be part of aging, but how you respond to it is something you can control. And that brings us to something even more important: what you can do every day through your lifestyle to reduce pain and protect your heart at the same time. Let's explore that next. One small change can protect a lifetime of heartbeats. You started this video looking for answers. Maybe you've been taking a pill that's always felt like a friend, one that helped you through stiff mornings or sore evenings. But now you see the full picture. That same pill used too often or too long could quietly be placing pressure on the one organ that keeps everything else going: your heart. This isn't about fear, it's about power. The power to choose differently, the power to listen more closely to your body, the power to ask your doctor the right questions and to explore safer options that honor both your comfort and your long-term health. You don't need to overhaul your life overnight. It can begin with a conversation, with switching one habit, with taking a short walk instead of another pill, with swapping something from your plate for something that truly nourishes. These small acts are more than habits. They are quiet promises you make to your future self. Your heart has carried you through decades of life, through joy and loss, through strength and recovery. It deserves your protection now more than ever, and you have everything you need to give it that protection, starting with awareness and followed by action. If this message resonated with you, if it opened your eyes or helped you think differently about the choices you make every day, I invite you to subscribe to this channel. We share real, practical, and honest heart health tips for seniors like you, because you deserve to feel informed, empowered, and never alone in this journey. Thank you for being here. And thank you for listening, not just to me, but to your own heart. It's been speaking to you all along. Now you're ready to listen back.